Are you interested in science and health? Are you passionate about good food? Do you enjoy helping people understand nutrition? Then a career as a dietitian might be on your menu. Dietitians assess, develop, deliver, and evaluate strategies and programs related to food and nutrition. They develop and study food and food products. They also manage food service systems, perform research, and promote food safety. Dietitians may work in a variety of settings, such as healthcare, food services, education, business, private practice, or research. To digest some of the details of this career, we spoke to a dietitian working in Alberta.
Hi, I'm Sydney and I'm a dietitian. A dietitian is someone who develops and implements personalized nutrition care plans. I myself work in bone marrow transplant in cancer patients. Dietitians can also work in food services. They can work in the public health sector as well as with the government. Some of them will also work with pharmaceutical companies, schools, social service agencies, and correctional facilities. They can also work for research facilities or fitness centers. Some of my duties and responsibilities are to interact with different members of the healthcare team to help to develop and implement those nutrition care plans. It can also involve quite a bit of research to determine what the best course of nutrition care is for a patient and to continually learn and develop new nutrition skills. A typical day as a dietitian starts with me coming into work and screening my patient list. I look at things like blood work, medications, any imaging or procedures that they've had. After that, I go to rounds where I discuss with other healthcare professionals what's going on with the patient and get any updates. And then I go and I see my patients. Sometimes it's to talk about how they're eating and work on ways to optimize their nutrition. Other times it's for education and we teach them about new diets or changes to what they're eating. Spend a lot of the time charting. That's an important part. Being a dietitian, you need to make sure that documentation is in place. It can be helpful to be organized as a dietitian because you have to balance a lot in terms of patient caseload and the different patients that you have to see. Being compassionate is one of the key things that makes a great dietitian. Every day is different, every person is different, so adaptability is a really important trait to have, as well as just a desire to continue to learn. It's really important that you're constantly wanting to learn and working towards learning and improving your knowledge and skills. I work standard business days, so Monday through Friday, during kind of regular business hours. We do sometimes work on weekends, so not all dietitians are on call, but most inpatient dietitians like myself will be on call a handful of times a year. To become a dietitian in Alberta, you'll have to have a Bachelor of Science degree in food and nutrition. It is also required to have a 1-year internship program, and both of these programs need to be approved by the College of Dietitians of Alberta. As a dietitian, there are some restricted activities that we can only do when we get additional training and approval from the college. One of those, for example, is the ability to prescribe IV nutrition. And so that's something that as an inpatient dietitian is very important for my job, but isn't necessary for other dietitians, like ones that work in outpatient care or in places like public health. I spend a lot of my day on my feet, so I'm walking in between different patient rooms and up to the unit. While I'm in with patients, I might do a physical assessment on them, so that does involve a little bit of touching when it comes to patient care. Some dietitians, especially the ones that work in an outpatient capacity, will spend a lot of the day at their desks, so that's a lot of sitting throughout the day. Or if you work in an area like public health, that's also a lot of desk work too. I just wanted to talk about the timeline. In terms of advancement, dietitians can also work in management and manage other dietitians, or some will work in consultancy and either work for private companies or work for themselves. I decided to become a dietitian because I've always had a passion for food and nutrition. One of the nice things about being a dietitian as well is that you have really great work-life balance, which not all healthcare professionals have, so that was an added bonus. One of the most satisfying parts of my job is just getting to bring people joy, especially when they're in the hospital. Food can be such a comfort for people, so being able to bring that to them in sometimes one of the hardest times of their life can be incredibly fulfilling.
the first time
If you're interested in becoming a dietitian, I'd recommend reaching out to a variety of different dietitians and seeing what their day-to-day life is like, because it is such an expanding field and there's tons of different things that you can do with this career.
To nourish a career as a dietitian, you must have good critical thinking, problem solving, and communication skills. Honesty, tact, and sincerity are also important qualities. If this sounds like you, a career as a dietitian may be an appetizing choice to consider. Consume more details about this occupation, including training requirements and salary ranges, in the occupational profile on the ALICE website. While you're there, check out some related occupations, including food scientist, health coach, and human ecologist. Explore the possibilities. Go to alice.alberta.ca.